Nursing Ethics, where we dive deep into the real-world application of the 2025 Nursing Code of Ethics. I'm Jodi O'Malley, whistleblower and founder of Righteous RN. In this course, we'll explore what it truly means to practice with courage, integrity, and moral clarity in today's healthcare landscape. Let's get started. In this session, we're going to explore what it really means to blow the whistle, not just as a dramatic act of rebellion, but as a professional and moral obligation when patient safety, truth, or justice. If I had understood this concept earlier, I would have come forward in January 2021, 1 month after the vaccine went public. But you know what? Everything happens for a reason, and God's timing is perfect. Still, I want you to take this to heart. This slide matters. No need for absolute proof. You do not have to have a courtroom-level burden of evidence. You are not a prosecutor. You are a nurse, an advocate. You don't need every document, every photo, every piece of data. If you wait for that, you might wait too long. Reasonable suspicion is enough. If something feels wrong and you have credible concerns, speak up. You're not making a final judgment. You're raising a red flag that something needs to be looked into. Your role is to sound the alarm. You're saying, something isn't right here. Please investigate further. That's it. You don't need to prove it yourself. We can't expect nurses to be silent until we're 100% sure. That leads to harm. When we lower the threshold to reasonable suspicion, we empower ethical action. I didn't plan to be a whistleblower. I was a nurse doing my job, watching harm unfold, and realized the system had no intention of fixing itself. I'm going to walk you through what happened when I exposed what I believed was unethical treatment at the federal level, what the retaliation looked like, how the system responded, and how I survived with my license and integrity intact. I saw unethical protocols, patient coercion, denial of informed consent, unreporting of safety signals to VAERS, investigational drugs prioritized over safety, and Centers for Medicaid Services, CMS, giving a bonus payout for their use. I documented what I saw and blew the whistle. I was reported to the Board of Nursing with 18 allegations against my license. I endured a 15-month federal whistleblower investigation by the hospital and a 5-day hearing in June of 2024. An independent ethics review concluded I acted on moral and professional grounds. It wasn't easy, but I'd do it again. You don't always know who made the complaint or why. The process can be slow, stressful, and confusing, but an investigator at the board is assigned. They interview the complainant and then get your side of the story. They bring it up in front of the board at their scheduled meeting and then decide how to handle it. This is the actual decision tree the board used to determine how to proceed. My case went all the way to the board meeting. You can follow along in your handout. This decision tree shows how the board decides what happens next. Some cases are dismissed, others lead to education requirements, a decree of censure, or a full hearing. I'm going to walk you through the actual complaint process used when nurses were reported to the state board during COVID. This isn't hypothetical. This is the path my case followed. Step 1. The complaint is received. The State Board of Nursing receives a complaint. From there, the very first question they ask is, did the nurse identify as a nurse and make COVID-related statements to the public or on social media that don't align with the standard or wildly accepted guidelines? For me, yes. That answer alone triggered an investigation. Step 2, statements to patients. Next question. Did the nurse make those statements directly to a patient? Again, yes. I advocated for patients' rights and discussed early treatment options. Step 3, recommending treatments publicly. Did the nurse recommend any preventative or curative treatments publicly, like meds not aligned with CDC or WHO guidelines? That was also marked yes in my case. Even though I didn't prescribe anything, I shared resources and supported patient-led decision-making. Step 4, prescribing or administering off protocol. Did the nurse prescribe or administer any non-standard treatments? They answered yes again. Even though I didn't prescribe anything, just talking about options was enough. Step 5. Then they reference a statute, ARS 32-160127. That's Arizona law defining unprofessional conduct, including spreading what they deem misinformation or disinformation. Was it misinformation? They answered yes. Disinformation? They answered yes. 2 yeses there meant the next step was mandatory, an ethics evaluation. Step 6. What comes next? Depending on the board's findings, they can require a few things. NPA education. That's Nurse Practice Act training. A state-approved COVID-19 nursing course. A formal ethics evaluation, or a combination of all the above. In my case, I was ordered to undergo a formal ethics evaluation. That evaluation, thank God, cleared my name. Recording patients or coworkers isn't normal. It's not something I ever imagined I'd do. But this wasn't normal. We were facing a specific danger to public health and safety. If I hadn't believed that with my whole heart, I never would have done it. And if I had to do it again, I would. Because truth matters, patients matter, and silence is not the standard of care. At the hearing, you'll sit before a panel, usually nurses and legal advisors. You can present evidence, witness testimony, and expert opinion. The board may ask tough questions, especially if policy was challenged. You'll receive a decision, dismissal, warning, suspension, or revocation. Even if you win, the emotional toll is heavy. But truth matters, and so does your courage in standing by it. As you can imagine, this was one of the biggest days of my life, and to have my children there watching it all unfold was everything. I stood in front of the board that day with nothing to gain and everything to lose. No paycheck, no protection, no reward. Here is an excerpt of an interview I did on Real America's Voice.
Over the last 2 years, a lot of wrong has been committed against Americans that actually had the guts to speak up and speak out about the COVID scam. In fact, you recall the HHS whistleblower, Jodi O'Malley, that came out to Project Veritas? Guess what? She's been cleared of any wrongdoing by the Arizona Board of Nursing. Of course she has, because she didn't do anything wrong. Earlier in the week, the Arizona Board of Nursing voted against taking any action against Miss O'Malley for blowing the whistle on HA's handling of the reports of the adverse side effects of the COVID-19 vaccine. You remember the video. Project Veritas released it last year. O'Malley had said that many of her coworkers at the hospital in Arizona she worked at were pressured to sweep their patients' side effects under the rug, not even report them. If you recall, in September, James O'Keefe from Project Veritas joined me on this show to discuss her blowing the whistle. She has seen, and she asked multiple nurses this, how many cases have you seen with the adverse reaction to the shot? And multiple nurses are saying, oh, tons, and they're not getting reported because the paperwork's too much. So glad to welcome her to the program, that whistleblower, Jodi O'Malley. Jodi, wow, I'm so glad, and this is what is interesting. A lot of you folks that have spoken up over the last 2 years about all the lies and BS related to COVID, as the court cases are now coming to fruition, everybody's winning. Because all this, it were lies, it was corrupt, it was evil what they've done to people. So glad to hear they cleared you. Are you, obviously probably won't go back to that hospital, but are you going to stick with nursing?
Absolutely. Nursing is who I am. There's no getting away from it. I don't think I could ever be in a hospital system the way it's ran now.
Right.
Yeah, absolutely.
Yeah, maybe go find a nice Nice doctor's office in a small town where you're actually just dealing straight up with the patients, no corporate BS, right? No government involvement.
Correct. I think what's happening in the country is more and more nurses are wanting to go to patients' home, and it's almost like going back to like home health and looking at the person holistically.
So well said. Such an inspiration. Jodi O'Malley, thank you for having the guts to stand up and do what you did.
Thank you.
You take care.
I appreciate it.
God bless you.